Thanks. We're moving on. Donna from Clayton, good morning.
Yes, good morning. Hi. I'm 51. I had a stroke 2 years ago, and I'm going through menopause. I've gained about 20 pounds, I guess, and it's just really hard to take it off. I have gone to health food stores and looked at the yam products and trying to find an alternative of something that will help me, but it always seems to say that, there's a potential problem with a stroke or blood clot or that type of thing, and I just don't know what to do.
Well, basically, the bioidentical hormones, especially in low doses, are remarkably safe. So we know that women, have heart attacks and strokes like men do, but prior to menopause, our risk for heart attack and stroke is much lower than men's. And the reason for that is because we have estrogen and progesterone, and those hormones protect us from heart disease. And after we go through menopause, our heart attack and stroke risk actually equals men's. And that's when the hormones are no longer there to protect us. So it's actually important, in my opinion, for preventing heart attacks and strokes that women take at least a little bit of bioidentical estrogen and progesterone.
Okay, and you mentioned the fake hormones. Those are the ones associated with
those
cancer
things actually
risk and
cause heart attacks and strokes. That's why it's
and
so,
that's the confusion.
Right. That's why it is confusing to people that there is such a difference between the bioidentical versus the fake hormones.
Okay, and that is you feel at the root of the controversy?
That's a big part of it, and also a lot of it has to do with the fact that the bioidentical hormones mostly are being done as compounded creams, and so the big pharmaceutical companies aren't making a big profit off of those. There are some bioidentical hormones that are available through the drug companies, and so it is FDA approved treatment.
Okay, let's go to Karen from Walnut Creek. Good morning, Karen. Do you have a quick question for the doctor?
Yes, thank you. I've had a period for a little bit over a year now. I also got diagnosed with systemic scleroderma a year ago. I'm interested in what would be the most natural form of estrogen replacement I could take this time.
Thanks, Karen.
Well, the actual natural bioidentical estrogen is called estradiol. Okay, so most women are taking what's called estradiol, and that can be actually combined with estriol as well. So there's actually three kinds of estrogen: estrone, estradiol, and estriol. And the combination of E2 and E3, estradiol and estriol, is called Biest. And a lot of women will take the Biest cream, and that is very effective.
Okay, I wonder, is this decrease in hormones, is this something that's inevitable with the onset of age? And again, this actually starts happening, people, if you think it's going to hit you when you're in your 50s, not true. It actually starts happening
in the
sooner.
30s.
Is it inevitable that we become depleted with hormones, or is there some way we can?
It is. It's inevitable. It's going to happen to everyone. Some people it happens sooner. It depends on a number of factors. Lifestyle, how well you're taking care of yourself. It depends on how much stress you've had in your life. People who've had a lot of stress, it depletes their hormones sooner. And if they aren't eating a healthy diet or taking nutritional supplements, those things can deplete your hormones sooner. So, but everyone eventually is going to be depleted.
All right. So just really quickly, because we don't have time to go to any more phone calls, but just tell me when somebody's just not feeling right, brain fog, whatever, give them a checklist of things to look at in their lives that might indicate that their hormones are depleted.
Well, obviously, again, we want to have a healthy lifestyle, a healthy diet, some exercise, those kind of things. But I would just really recommend getting the hormone levels checked. And so, we can do the estradiol level, the progesterone level, the testosterone level, and then thyroid. We need a free T3 and a free T4 and a TSH. These are thyroid tests that are very important to make sure that that's okay. DHEA, this is a hormone we can test for. So there's so many hormones that you can test for, and if you're low in any of them, they need to be replaced, and people feel so much better when they are replaced.
Thank you, Dr. Mielke. Unfortunately, we are out of time, but if you want more information about Dr. Mielke, you can call her at 925-846-8000 or visit her website at optimalhealthspectrums.com.